So the physician wants me to give baby Reese, which this is our infant, a flu vaccine, well, an influenza vaccine of 0.5 mLs, and I would take my order to my room where I would get my dose, and I could pull the dose out of the fridge, compare, if I wasn't familiar with the medication that they wanted, I could look in my PDR and get the right route, the right technique, and the right dosing for the infant. And then, so I would get that information, make sure it was right with what the doctor ordered. I would pull it out of the refrigerator, check and make sure it's the right medication, the date and the lot number, the expiration date is within limits, it is, and make sure that there's nothing inside the liquid, because it said it should be yellow and clear, and there's no sediments in there. And since it was refrigerated, we need to warm it up, and we would warm it up in our hands. Not almost drop it. And then I would check again, make sure it's the right medication, right dose, and I would check the expiration date just to be on the safe side again. And then I would take an alcohol swab. Well, I'm going to sanitize my hands before I do this. I'm going to say, this is my alcohol swab. I would clean the top of the medicine, the cap, and then I would, with the cap on to keep it sterile, I would measure out the amount just in air to make sure I equalize the pressure inside the vial. So I would measure out 0.5 mLs, and I would place this inside the center, push in the air, tilt up, and I would draw out my medication, and then I would make sure I flick out any air bubbles that is needed. But in this, I already have my medication drawn up. And then I would place this cap on it. That's the only time we recap a needle, is when it is still sterile. So this is my tray to take into the room where the patient is. So I would recheck again, make sure that the prescription matches the medication and the dose, and then I could place this back into the refrigerator, and those are my 3 med checks for just the vial. So when I go into the patient's room, I would want to make sure I got the patient's full name and date of birth from the caregiver, and I would ask them if the baby has had any recent illnesses, any fever, vomiting, because you want to make sure that the dose isn't going to be interacted with any viruses that the child may have had. So normally we would do this on the thing, but I'm just going to demonstrate a little bit. I would have the caregiver make sure that the child's thighs are in view, and I would make sure to check which leg I want to make sure I want to use, which this one looks perfectly fine. And you're using the vastus lateralis muscle, which is your side muscle, and you're going to measure, make sure you get right in the middle, so you got your hip and then right above the knee, and you're going to go in the middle, and you're going to make sure that it's the nice meaty part. And I would grasp it to make sure I would have enough, and that would also determine my needle length for what size of needle I would use, but I would have done that before. I even drew it up, but I can still change it if I have to. So this location would be perfect for me, and I usually kind of keep my finger there, and I would use my alcohol pad, clean the area, and I would have my gloves on, and my hands would be sanitized as well, which I did sanitize them. I would explain to the caregiver make sure that they had their VIS sheet and they had received it. They had no questions about the vaccination, and the baby had no reactions from any previous vaccinations. I think the other one would just be in the hospital. But I would then again, once the parent was ready, but I would make sure that the bevel side is up and you would frame your spot. And I'm not going to inject this, but you would inject right in 90-degree angle all the way into the hub of your needle. Since I'm not injecting that, I'm going to recap this. And you don't have to aspirate on an infant. You would just inject your medication, pull out, apply a little bit of pressure just to make sure that there's no bleeding, and place a Band-Aid as soon as possible. And the caregiver can then pick up the child. Oh. And then they could calm them. And I would make sure I dispose of all my utensils into the sharps right after and ask if the caregiver had any questions, and then I would excuse myself.